Thank you for inviting me this afternoon. This is the second time I've had an opportunity to present at the Wyoming Goes Global conference. I so enjoy it because our Honduras project is something that I'm so particularly proud of and very pleased to be able to share with you the kinds of wonderful things that we're doing at the College of Health Science and actually throughout our Laramie community, as you'll hear, and certainly throughout different disciplines within the University of Wyoming, including the College of Law. First, I'd like to thank Dr. Joseph Steiner, who has just been so exceptional in his support of this project. I really do appreciate his time and effort that he takes with us in discussing ways to continue this support. My dean, Dr. Mary Berman, who has also been fabulous in really having to go to the plate to continue this project. And Dr. Sue Steiner, who is my faculty that I go to, and she's my go-to girl when I have issues with anything going on interpersonally in the trip or just the logistics of planning the trip. So thank you. Do I click it down? This is where, okay, so, got it, okay. You might ask, and we have had this asked to us before, why are you going to Honduras when there are so many medical opportunities here in the United States, and certainly in our state of Wyoming? As a nurse, I certainly understand that. However, coming to Honduras has offered our students opportunities to look at different cultures, also to learn a cultural competence that we cannot learn here in the United States, and also just a fabulous opportunity for them to see what medical care, particularly medical care and nursing care, looks like in a developing nation. In fact, Honduras is one of the poorest countries in the world. When we began this project 10 years ago, it was the poorest country in the nation. Why do we go to Intibucá? Because Intibucá is the poorest area of the poorest, one of the poorest countries in the world. You can see our town called Agua Salada. Agua Salada means salty water. Honduras is a country of contrast, and when we're at the airport and we're telling people we're going to Honduras, they're so happy for us that we're going to spend a week at the beach. However, truly Honduras is a country of contrast, and you can see that the top being the Roatan and the islands, which are absolutely lovely, and sometime in my life I'm going to go and visit, but this is my world here on the bottom. And frankly, if you ask me, would I rather go to Roatan or come to Agua Salada, I would very much prefer to be coming to Agua Salada. Here you can see these are the statistics and the demographics of Honduras as a country, looking at the life expectancy, which is really not that much different from ours. However, infant mortality used as a reflection of what's going on in the medical care of this particular country shows that things are really not all that they should be. We're comparing this infant mortality rate with 20 over 1,000 to the U.S. rate of 6 over 1,000. And I'm sometimes embarrassed to say, but must say that when we look at other countries like Western Europe and Scandinavia and Japan, we're looking at rates that are more like 2.5. So the United States also has some work to do on that particular issue. How did we start this journey of going to Honduras? And it began in 2007, where a group of university faculty, most of them from university faculty residency programs, hooked up with this program called Shoulder to Shoulder. Shoulder to Shoulder is an NGO, non-governmental organization, which was founded by a faculty member from the University of Cleveland who decided it would be beneficial for his medical residents at that point to go down and have this kind of experience in a developing country. Then they had this brilliant idea, which I truly think is brilliant. They started to think, as you've seen here today, all of the resources and the fabulous things that are happening in American universities and the strengths that we could tap into. So they decided, well, why don't we invite other universities to come down to this part of Intibucá also with us and be able to use their resources to provide care to these particular communities in Intibucá. It ended up, and I'm not quite sure, I've heard different stories, how the University of Wyoming was assigned Agua Salada. However, it turns out that Agua Salada was the poorest of the poor of all of these towns and villages that were assigned to different universities. We partner with Brown, University of Cincinnati, University of Minnesota, and Rochester are the main components of people who come down, and they have their own villages and they have their own places that they take care of clients. I think that we've considered as a group that we've been very lucky to be assigned Agua Salada, and that the challenges of the poorest of the poor have offered us a lot of opportunities that I'll speak of further as I go along here. So what do we do? Since 2008, we have been going down to Agua Salada at least twice a year. We have also gone 3 times a year at one point, these brigade visits, and I'm very happy to see some of our brigadiers, is that what we are? Yes. Here in the audience today, and I appreciate them coming. We go down and make visits 2 to 3 times annually with brigades that last between 9 and 12 days. We provide health care, basic health care, dentistry, education, and we'll go on further than that, all of it in keeping with the guidelines that Shoulder to Shoulder provides for us. What is very, very, very different about the University of Wyoming team, and I'd like to emphasize this, is that we are truly an interdisciplinary team. You'll find the Rochester team is completely medical students, medical residents, and medical physicians. University of Minnesota is the one nursing brigade that goes down. The rest of them tend to all be medical residents and medical physicians. So we are not that, and that in so many ways Wyoming is very different than the rest of the United States, and I think that this reflects in the components of our team. We have had lawyers come with us who have actually helped us draw up clinic contracts. We have had many geologists come with us. We have had people from modern languages come. We have had people come from pharmacy. We've had people come from speech and hearing. We've had people come from the community who are physicians. And so I think that helps us to be a little bit different and accomplish the kinds of things that we're able to accomplish. And in fact, I just got home actually this morning from what was our 20th trip to Honduras, and during those 20 trips we have facilitated over 400 faculty, student, and community experiences, which have equaled 6,500 patient visits, so quite substantial. Here we are. It takes us 48 hours to get to Agua Salada. It's in a very mountainous corner, and this requires that we take trains and buses and trucks and the last piece to ford the river right before we get to the town. Honduras is a very beautiful country, and as you can see, this is pretty much a shot of what it's like, very mountainous, so we like that coming from Wyoming. And here's our little town, Agua Salada. This is the whole town. There are 26 homes built up into the mountains, but this is what you see when you come into the town. That building on your left is the church, and that building on the front, I'm never quite sure what it was originally. It was our pharmacy at one point. We began consultation in the church, and it became problematic in that it was problematic for the Catholic priests, saying this was really not the proper use for a church. This demonstrates some of the students coming to see us. These students will literally walk for 3 hours each way to come and see us. We use the community partnership model when we talk with the community, and in fact, we asked the community, what would you like us to do? And they said, please build a clinic. We thought, oh my gosh, that is going to be very difficult here. But due in large part to Dr. Penelope Caldwell, we were able to raise funds and started building a clinic in November of 2011. This clinic was designed by engineering students from the University of Wyoming, and a lot of the foundation was laid by volunteer firemen from Casper. This is how we got things down to the clinic. This artist type about my age said he would be very happy to drive this van full of the exam tables and the rest of it down to the clinic, and as I waved goodbye to him from the front of my house, I thought, I will never see you again. But in fact, he did drive all the way from Laramie, Wyoming to Agua Salada, and our clinic was completed in July of 2012. The design was designed by an architectural student of Asian heritage, and I think you do see something of an Asian influence there. For those of us who go to Agua Salada, as Al can attest, what's very exciting for us is the new bathrooms. And so although the rest of it's also wonderful, this is what we consider to be the best. These are some pictures of the new way that we have consulta in the clinic, and those are our bedrooms back there. Other programs that we are also involved in, public education of the community, public health education of the community. All of my students are required to do a piece of community health education while they're there. We've also done some education with midwifery in the community, including neonatal resuscitation. And these are the home visits, which are my favorite part. And this is how we go on a home visit, with a guy in the front with a machete, the students going up. These are the people, and this is pretty much what we find when we go on these home visits. We have tried very hard to, in helping to find some sustainability, in trying to get things going in Agua Salada. And so we have started having some investment in the community, which are including microfinance projects, teacher training, and then this is what I'm most proud of, is our scholarship group. In our village, children go to school till 6th grade, and after that they are not able to go to school. That requires them to go up the hill for about a 90-minute walk each way. And they don't have money for the uniforms. The education is free, but the uniform and supplies are not. So we've started this, and it would be Joanne Theobald, our social worker, who has spearheaded this. We started with these 5 students. We now have 30 students between grades 7th, 8th, and 9th. And we'll be sponsoring our first student to go to a different town, Concepcion, to go to the equivalents of high school. We were exceptionally pleased when our last group of 5 students was included 1 boy and 4 girls, as this is very much a patriarchal society, and we do see that as a way to educate women and perhaps make big changes in Honduras. Thank you.